Hi guys, my name is Andrea Guzman, and my presentation today is going to be on gambling addiction. I wanted to start off with what is addiction? The American Society of Addiction Medicine defines addiction as a primary chronic disease of brain reward, motivation, memory, and related circuitry. A person who is experiencing addiction will display some of these: inability to consistently abstain, impairment in behavior control, craving or increased hunger for drugs or rewarding experiences, diminished recognition of significant problems with one's behavior and interpersonal relationships, a dysfunctional emotional response. I also wanted to include what is behavioral addiction. Behavioral addictions are typically defined as compulsive and impulsive behaviors where an individual persistently and repetitively engages in actions without it necessarily leading to reward or pleasure. Nor does this individual reflect about the consequences of their actions. So they're not necessarily doing it to win. They don't care about the reward, like it says. They're just in it because they are wanting to engage in this kind of behavior. The individual with a behavioral addiction will continue to engage in these behaviors despite the consequences of endangering one's health and the loss of one's job, loved ones, or spouse. What is gambling addiction? So, gambling addiction is also gambling disorder. It is a behavior that is damaging to a person or their family, often disrupting their daily life and career. I wanted to include some statistics of who it affects. About 2.5 million US adults are estimated to meet the criteria for a severe gambling problem in a given year. Another 5 to 8 million would be considered to have a mild or moderate gambling problem, as they do not meet the full diagnostic criteria for gambling disorder, but meet one or more criteria and are experiencing problems due to the gambling behavior. So gambling disorder, according to the DSM-5, is a persistent and recurrent problematic gambling behavior leading to clinically significant impairment or distress, as indicated by the individual exhibiting four or more of the following in a 12-month period. 1. Needs to gamble with increasing amounts of money in order to achieve the desired excitement. Is restless or irritable when attempting to cut down or stop gambling. 3. Has made repeated unsuccessful efforts to control, cut back, or stop gambling. 4. Is often preoccupied with gambling. 5. Often gambles when feeling distress, helpless, guilty, anxious. 6. After losing money gambling, often returns another day to get even, also known as chasing one's losses. 7. Lies to conceal the extent of involvement with gambling. 8. Has jeopardized or lost a significant relationship, job, or educational career opportunity because of gambling. 9. Relies on others to provide money to relieve desperate financial situations caused by gambling. These are some probable causes, like biological risk factors, physiological risk factors, environmental, and psychological factors. physiological aspects. A physiological aspect could be a person with a gambling disorder who will experience physiological arousal that is manifested in heart rate increases and elevated cortisol levels. Some behaviors and emotions are that they may continue to engage in gambling behavior, again, despite consequences with relationships and financial difficulties, difficulty to cut back or stop their gambling. Some people will lie to cover up their behavior or excitement and engage in increasing the risk of the stake to feel alive. Here are some more physiological aspects. So the brain system reward is activated by dopamine. It is a neurotransmitter inside the brain that reinforces sensation of pleasure and connects those sensations to certain behaviors or actions. Higher levels of dopamine release are also correlated with greater subjective excitement and gambling severity. Here is a image of a brain the potential losses and potential gains. On the blue side, dopamine not released when expecting a loss, so there is not a big release on that. On the other side, the dopamine for potential gains is flooded with dopamine when expecting a win. So we can see that the brain lights up significantly compared to when the person is expecting a loss. Some more psychological aspects. Gamblers with substance use disorder have more mental health issues. So as future clinicians, we should be able to assess whether the problematic gambling behavior is primarily driven by substance use or if it represents a separate gambling disorder. Sometimes the gambler does gambling as a way to escape from problems or negative emotions, seeking relief or distraction through gambling. This criteria suggests that gambling becomes a coping mechanism for emotional distress or like an escape. Some quick social aspects is the impact of a problem with gambling may damage social ties, including family and extended social relationships, and can lead to financial and legal problems. As we've mentioned many times, the financial part of it is a big deal. The gambler's relationships with family members often change as a problem with gambling develops. Arguments between couples can escalate to domestic violence or other family issues. I wanted to include some treatments for gambling addiction. Psychotherapy and family therapy are, again, one of the most sought out forms of treatment. There's also 12-step programs like Gamblers Anonymous, also cognitive behavioral therapy. Here I just explain that that cognitive behavioral therapy is effective in reducing pathological gambling. These treatment approaches encourage individuals to identify use patterns, learn to recognize and avoid triggers, and identify lifestyle changes to avoid high risk situations. I wanted to include some support, National Problem Gambling Helpline, the California Council of Problem Gambling, Gamblers Anonymous, and Self-Help for Spouses, Families, and Friends. And these are my references. Thank you very much.